Hello and welcome along to another episode of Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. I'm Steve Bland, and think of this podcast as a bit of a how-to guide to help you overcome common myths, fears and barriers to cancer prevention, diagnosis, treatment and care. As always, we want to give you, whether you're a patient or a healthcare professional, some tangible things that you can do to help when it comes to cancer, because while we know that not all cancers are preventable, there are things we can all do that can make a really positive difference to our health and the health and well-being of our family, our friends and our colleagues. And actually that's a really good lead into the topic of this episode, because we're talking all about the mental health of cancer patients and specifically psychosocial support. This is an in-depth look at how the North East London Cancer Alliance is helping people with cancer cope with the emotional, social and mental challenges of their illness and treatment. Now, what is psychosocial support? Well, I'm not the best person to explain. I'll leave that to our guest, and that's Caroline Dancyger, who is the Psychosocial Clinical Lead for the North East London Cancer Alliance. So Caroline, this episode is all about then improving the mental health of cancer patients, but people who've listened before will know my backstory. So I'm going to bring in partners, families, people around the patients as well. Let's start by just defining what we're talking about when we say psychosocial support. In the context of cancer care, what are we talking about?
So I guess broadly, psychosocial support refers to all of that stuff that happens that isn't your medical healthcare treatment. So your psychological well-being, your mental health, your emotional kind of well-being, but also you're kind of addressing your social needs. So then, and that might be really varied. So it could be like housing or finances, or the context of kind of social connection and remaining connected to one's community, or indeed kind of forming new communities, and then also thinking about spiritual support. So that's the kind of broader umbrella term. The reality is actually, I guess what I do is the bit around psychological well-being, mental health, emotional distress. I've got colleagues doing some of the other kind of more social and spiritual bits.
But it's so important, isn't it? And I imagine, you tell me if I'm right, but it feels like not just in cancer, but in every walk of life, this is much more of something people are talking about, much more aware of. Has that been the case in cancer as well?
Yes, definitely. I would say, and sometimes I feel a bit controversial saying this, but my general kind of view is if you have a significant health condition, then in some ways you're lucky having cancer, because you're much more likely to get access to psychological or mental health care than any of the other long-term or significant health conditions. So generally over a long time there's been a recognition that we need to be thinking about people's mental health alongside their physical health care needs in cancer. And in fact it's been kind of sort of termed by the International Society of Psycho-Oncology, which is the technical term for what we're talking about, that it's the fifth vital sign in cancer care, thinking about mental health and well-being. But definitely over recent years, that has become much more kind of higher on, that's bad grammar, but higher on people's radar. Certainly within the UK, I would say as a result of COVID, actually, the recognition that people who were undergoing cancer treatment, both that their care was significantly impacted, but also that because of their immunocompromised status, that they were much more kind of socially isolated, needing to stay at home. That definitely kind of put it higher on the radar, the fact that we need to be thinking about well-being.
And how big a part does that play in, the grand scheme of a patient's health, their ability to deal with their cancer treatment? There are some people, maybe an older generation, that might think, you just get up in the morning, you get on with it, and you put a brave face on and stuff. But actually, looking after that side of your well-being, how important is that in the kind of bigger picture of how you cope with the cancer kind of journey?
good question. The short answer is it probably depends on who you're talking to, but given that you're talking to me today, I think it plays a massive, massive part for a really significant number of people. We know, for example, that people with undiagnosed sort of mental health problems, so we're talking about one kind of extreme here, one end of the spectrum perhaps, we know that they often have worse cancer outcomes. They have longer admissions. Their life post cancer treatment is more difficult to kind of re-engage with, and so there are lots and lots of studies showing, in fact, that if we have untreated mental health problems and cancer, and in fact lots of other kind of long-term health conditions, that you have worse physical healthcare outcomes alongside social and economic kind of outcomes. So that's one end of the spectrum, but actually generally for everybody to be able to deal with both the diagnosis, the treatment and the ramifications of that for your life, looking after your psychological and emotional well-being, being able to kind of access social support, whether that's through your family or friends or kind of more formalised cancer support, is hugely protective, both in the short term and long term.
And this is more than one of my pet hates, and I've heard it a million times when someone gets cancer, and there's always someone that says, "Oh, go on, be positive, and you'll get through this." As if just, smiling every day and bouncing around like nothing's happening will actually do something to your cancer. But obviously that's not the case. But I imagine there's a link, positivity doesn't cure your cancer, but it might make you look after your, what you're eating more. It might, make you look after the things around it maybe a bit better.
Yeah, it's really interesting. In fact, there was a study many, many years ago, I think back in the 70s, and they looked at different ways of coping with cancer and what that meant for cancer outcomes. And there isn't kind of any strong evidence to show that coping in a certain way, whether that's being positive or anything else, leads to significantly different cancer outcomes. But it did suggest that if you have a sense of kind of fighting spirit, that you think, okay, this is a challenge that I can deal with, as opposed to this is a challenge that completely overwhelms me, that was helpful. Within the world of sort of psychological, for psychological specialists in cancer, we often talk about the tyranny of positives. That if you're only thinking I have to be positive, that feels hugely burdensome, because our minds don't work like that. We might be able to have positive thoughts at some point, but equally there might be kind of creeping doubts of what does this mean to me? Am I going to get through this? Am I going to survive? What are the implications for me in the long term? And we need to be able to acknowledge all of those different thoughts and feelings and emotions that we have. We shouldn't try and deny any of it. It's about...
That's hugely impactful, isn't it? Because if I've heard this loads of times from people who beat themselves up almost if they're not putting a brave, what they would call a brave face on every day, and actually they might have a really positive outlook, but a cancer, the journey of a cancer diagnosis is incredibly difficult, and it's a real roller coaster, isn't it? There's
Absolutely.
The days when you feel like you're gonna, get through this, and there's days when everybody will have gone through this with cancer. You feel like you're probably going to die.
Yeah.
You feel like it will get you.
Yeah.
Rachel, my first wife, Rachel, had this where, she would have days when I remember her saying that it's going to get me. It's going to get me. I know it is. And then days when she'd go like, right, we're doing this today. And that didn't mean that she wasn't positive all the time, but that's just the reality of a cancer journey, isn't it?
Absolutely. And I think particularly if you're in the midst of a treatment that is making you feel so unwell, how are you going to be positive in that situation? If you're lying in bed feeling really sick, loads of aches and pains, issues with your bowels and your digestion, I think it's completely understandable and reasonable and rational to say, this is really shit and I don't know if I can get through it anymore. And that doesn't mean that you're not going to get through it. You can still have those thoughts and feelings and do what you need to do and find a way through.
But there's always a friend, isn't there, that goes, come on, you've got to be more positive than that. And, generally the people that maybe haven't been in that position or, been through something similar, who don't understand how difficult that is, to have that burden of having to feel like you're being positive all the time. It's really difficult.
It's really difficult. And I think sometimes what that can do for some people is shut them down from actually sharing with people what they're really experiencing.
Yeah.
Because if you're always being met by a response that's sort of invalidating or saying, no, you're doing the wrong thing, you're feeling the wrong thing, you're not going to continue to try and seek support from that person.
No, definitely not. I mean, it's like, as we said, a cancer diagnosis and dealing with treatment is incredibly difficult in so many ways, physically, emotionally, mentally. And that's why you guys are there, for dealing with that side of things. So what sort of services do you offer across North East London then to help patients tackle this side of their diagnosis?
Yeah, so there's loads on offer. A lot of it actually being provided not through the NHS, through third sector organisations, charities like the Maggie's. We have a Maggie Centre, St Bart's Hospital, which is where I'm based most of the time. It provides loads of support, obviously Macmillan, and lots of other cancer charities, both national and kind of local, smaller charities providing support in all different kind of forms. Within the NHS, we provide individual talking therapies, and not just talking, actually. We also provide art psychotherapy to patients. We provide workshops where people can come and both learn, hopefully a little bit from us about some of the things that could be helpful, but also connect with other people who get what they're going through because they're going through it as well. And we do quite a lot of work with our medical and nursing colleagues, both to kind of help them to help and support people undergoing treatment, but also sometimes we might do some joint work with them to enable people to kind of access some of the treatments that might be difficult for them to access.
That shared experience, I think, is really important for the mental, emotional side of a cancer diagnosis. I can only speak from my perspective as a partner, but even from my perspective, having someone that had a shared experience with me, was massively important. And I can imagine that's, so important. It was some of the, we did an episode from Maggie's last year, I think it was. And I think you look at some of the groups that they have, the community they built up there. I imagine for a patient's mental health, that must be really, really, really good.
Absolutely. I think those kind of groups that people can access at Maggie's, or some of the things that we provide in the NHS that provide something similar and other places, can be hugely helpful. It's not for everybody though. And I think that's the thing that we are trying to do in North East London, to think about the fact that we can't just provide one kind of offering for all of our population. So the very easy example being, if you don't speak English, it's really difficult to access some of the groups that we and Maggie's and other places provide. But yes, being connected to other people is generally really, really helpful.
How do your services fit in with the rest of the kind of cancer ecosystem? Because we know, and that this is really, really important, but I imagine there's a tradition or a not saying that people will underestimate the importance of this side, but is there maybe a portion of people who would say, no, we'll do the treatment first, and this is nice extras. If we can do this as well, this is great, but we need to focus on the actual treatment as well. How does it kind of fit in the whole ecosystem?
So do you want me? There's kind of two answers to this, I think, Steve. There's probably the sort of the answer, which is, I think, what people would like to say, and then there's a little bit of kind of my lived experience. Yeah,
let's do both. Let's do both.
So I think everyone acknowledges that psychological care, supporting patients from the point of kind of diagnosis, and actually for lots of people perhaps before, all the way through, and beyond treatments for those people who are having curative treatments or living with cancer in the long term is important. Everyone would acknowledge that, and we work really closely with our medical and nursing and allied health professional colleagues, and so they will be thinking about people's emotional, psychological needs, having conversations, flagging up people to us who might need kind of more support, and it is seen as a integral part of cancer care.
Yeah.
And then there's a little bit of my lived experience,
Yeah.
and I think this is I'm being really honest here, and I think it's understandable because we work in an organisation, in an NHS where resources are limited.
Yeah.
That often other things take priority.
Yeah. Yeah.
And I think there can be a bit of a narrative of, well, we need to diagnose and we need to treat, and we need to invest in that.
Yeah.
And sometimes that means that some of the other things that the patients and families tell us matter hugely to them, like psychological well-being, like rehabilitation after treatment, can get slightly forgotten.
But that's
about.
understandable. That's not even, criticising anybody, is it? That's understandable that if you've only got, finite resources, that you've got to sort of figure out your priorities. And it's not saying this is, not important, but there are other places that need money, and that's fair enough, I think. You talked a little bit about after treatment as well. That's a massive part of it, isn't it? We've talked on the podcast before about some charities that are, working with people after their treatment finishes. The perception, I think, for people that maybe haven't had any experience with cancer, lucky people, is that you just dance off into the sunset and everyone's happy. But the impact of cancer goes, the scars stay with you for a long time, don't they?
Yeah, absolutely. Again, not for everybody.
Yeah.
Sometimes people do, have their last day of treatment, walk out of the hospital, feel like, well, that's done and dusted, and I can just move on and get on with my life, and that's great. But for lots of people, that isn't the case, either because they're living with cancer for the long term, or because the consequences of cancer, both physical and psychological, mean that it's really hard to get back to whatever idea of kind of normal they had sort of when they were anticipating life.
Normal is very different afterwards, isn't it?
Absolutely. It's a completely different world. I often think once you've had cancer come into your life, it can't be removed.
Yeah.
Like it's there.
Yeah.
Always, in the way that anything is, becoming a parent, you can't then not be a parent. It always informs the way that you're perceiving the world. And we know that there's loads and loads of worry also about what happens in terms of cancer coming back or progressing. And it's one of the things I think, again, within North East London that we've been thinking about over the last few years, that if we can support people at the point of end of treatment to manage some of those potential natural, understandable worries around cancer coming back, that we can prevent that from becoming more problematic.
How long would that go on for after someone's treatment finishes, or is that down to the patient?
It could go on forever. Sometimes,
right.
Sometimes I've met people who've said 10 years afterwards, I'm still, thinking about this every day.
Yeah.
For lots of people over time, as you start to regain trust in your body, if you're having kind of regular scans or checkups afterwards and everything's looking okay, you start to kind of develop a bit more reassurance. It's all right. But for lots of people, it's still there, hanging over them to a greater or lesser extent.
Do you have? Do you see a difference in the take-up of your services from men and women?
Yes. Yeah. So we look at our data across North East London, and I can't remember exactly the figures for the other two trusts, but for us at Barts Health, 2/3 of our referrals come for women. And that's also reflected in generally referrals to psychological services in any different mental health context as well.
Why do you think that is? Because I think I don't think men are less. They don't want to talk any less than women, but I think we have a system set up where we we sort of think there's only one way to do it, and I think that men need a slightly different approach. I don't know what approach that is, but I think there's loads of men that I speak to and have spoken to over the past few years who are desperate to talk to somebody but don't know where to go because the services that are there, maybe they don't want to sit in a room with a load of people.
Yeah.
They want it a little bit differently.
Yeah, I absolutely agree. I think often our services are set up expecting people to be able to come forward and say, I'm struggling, to start with, to ask for help, and then to feel comfortable in the kind of formats that we can provide, whether that's one-to-one support or kind of through group support. And I think we need to be thinking more about how we do things differently. But I also think maybe we are not being uniform. We're not asking the right questions to different cohorts of people. We're expecting everyone to give us the same kind of answers or to volunteer the information, and maybe we need to be thinking differently.
I think that's the point, isn't it? Like, I think women would typically be a bit more proactive, would volunteer the fact that they need help, would go seeking it, whereas I think men, maybe you need to be proactive in getting it to them, going after them a little bit and grabbing them, and that was certainly my experience. Obviously not the same as having a cancer diagnosis myself, but as a partner, when Rachel was diagnosed, it was almost like, oh, and we're here for you, here's a leaflet, and then back to Rachel. Yeah. Which is fine, and I never wanted, I never wanted to take any of the focus away from her. That's never, what you want as a partner, and we'll come on to that in a second. But I just, afterwards, I felt like I was never going to do anything with that leaflet. It was always going to go in a bin or in a drawer or something. Yeah. And it had to be a bit more proactive. I don't really know what the answer is, but a bit more proactive, I think.
Yeah, I agree. And I'm not sure that we've got it right yet either.
When I was saying this, and I don't even know what the answer is myself, but I just, we hear this kind of thing trotted out, men don't like to talk as much as women. And I don't think that's the case. I just think we're just probably not set up to give them the right avenue to do it. Let's talk about partners while I've brought it up. Because I can remember Rachel saying to me when she was quite ill, this is worse for you than it is for me. I was like, what do you mean? And she said, well, you're looking in, you can't do anything. Yeah. I'm in the middle of it. I at least feel like I can do something here. I can go and have my surgery. You can't do anything. You're just looking in, and that's not meant to kind of make anyone feel sorry for us. And I'm still here and Rachel isn't. But it is hugely hard. Absolutely. On the other halves, on partners, on close friends, on family, when somebody's going through a cancer diagnosis, isn't it?
Really, really difficult. And I think what Rachel said to you, I think has real validity. It's because when we see somebody in a really difficult situation, experiencing lots of kind of assault on their body, going through everything that she would have gone through, the desire to help, to make it better is so great, isn't it? That's what we want to do in any situation, to make it better. Yeah. And it's very, very hard to then find yourself in a context where you're really limited in what you can do,
and you don't understand.
You feel helpless.
I felt completely helpless. The challenge for partners is I can remember. I remember a friend came up to me afterwards, after Rachel had died, and he said, this is maybe 6 months after or something, and he said, when Rachel was ill, I was really worried about you because you looked really unwell. I'd put on a bit of weight. Maybe I was, quite white. I wasn't sleeping very well. And he said, I was worried about you. But the trouble is, when you're in that as a partner, I never wanted to have any fuss on me.
Yeah.
Everyone says, "Are you okay?" And I say, "Yeah, fine." Because if Rachel knew that I was struggling as well, that just heaps it onto her, and she already felt guilty about the way that what she perceived she was doing to us. So it's really difficult to actually know what to do, because I don't know. We were chatting before we started recording. I don't know that if the support was there for partners, even if I'd have taken it up, because I think, as I say, I think that would have made Rachel feel even worse than she already did.
And I think often what happens is that couples, families can get into situations where nobody really wants to tell one another how they're feeling, because you don't want to burden the other one, or make the other one or the other people in your family kind of feel bad or guilty for what's happening. And then everyone has to find a way of sort of dealing with it on their own. And it's really unfortunate, because there are services like mine. We provide loads of support to patients, to the cancer patient themselves, and we don't provide something to significant others, relatives, partners in their own right. Sometimes we will do couples work where it's feeling particularly problematic, but if you'd have been here in North East London and wanted support, you wouldn't have been able to get it from us. You would have been able to get it from Maggie's. But I think, again, even though we know that family and partners are so important, and that you're having your own challenges, it's still difficult to be able to access what you might have needed.
Yeah, I mean, it's never going to be perfect, is it? I think there's never going to be, people are never. We know, resources are stretched, and I think. But then thinking about how your service has maybe changed over the last 10 or 15 years, how, I mean, you tell me, but I imagine, more people are accessing it. Like, your services are wider, much more wide-reaching than they were. Absolutely. I mean, you tell me how they've changed in the last 10 or 15 years.
So 10 or 15 years ago, well, about 15 years ago, I'm trying to think, yes. So I've worked at Barts for 16 years. 15 years ago, there was next to nothing. Yeah. So now our team has got much, much bigger. We're providing much more support. Even over the last couple of years, in fact, we've had some additional funding that's come through the Cancer Alliance and Macmillan, and our referrals have doubled.
Wow.
More than doubled, and we're providing more support to people who are having their treatment away from St Bart's, which is the kind of the main cancer centre in our trust, to some of the other local hospitals. We're meeting the needs of people with more different communities, which is great. We're trying to address some of the inequalities in access to psychological care. And providing a lot more to people. And again, that's replicated for our colleagues out in North East London, and our colleagues in City and Hackney as well. So we're definitely reaching more people.
That's brilliant.
But I think that there's still much more to be done.
But it's never going to be perfect, like I said. But that's brilliant to hear, and I think it's only going to keep going the same way, isn't it? As
absolutely.
More and more and more people. Want the work that you guys are doing, and appreciate the work, patients and the people that pull the strings and make decisions appreciate the work that you guys are doing. That the more, the further this will go. A funny question, I guess, because maybe there isn't anything typical. But are there any common things that maybe you guys see? I'm sure every day is different, every patient is different, but are there any sort of common themes that you guys are dealing with?
Yeah. So a lot of what we do, we would frame as adjustment work. So helping people to adapt, to adjust, to make sense of life-changing experiences, whether that's at the point of diagnosis or going through treatment or at the end of treatment. So people finding it, essentially, like, how did this happen to me? How do I make sense of my life now? And what is it that I want from the future going forwards, with the limitations that I might have as a consequence of cancer. So that's a big part of what we do. And as I say, we do a lot of work around managing and supporting people with fears about cancer coming back.
That's a really difficult one. I imagine it's really difficult for you guys to tackle because you can't say, "Oh, don't worry,"
No,
because it might come back.
Yeah.
You know, it's really difficult to. How do you help people deal with that really understandable and ever-present fear?
Yeah, so we do a lot of both kind of acknowledging that that's a normal, natural fear, that it's protective, in fact, because it's what keeps you doing the things to look after your health. If you weren't worried about that, then maybe, you know, you wouldn't be continuing to kind of check your breasts when you need to. You wouldn't be attending kind of scans. So we do a lot of normalizing of that fear, of thinking about, is it taking over? Is it taking up more time than you want it to in your life? And if it is, we sometimes introduce some new strategies to people to help them to kind of keep it in check. And then we do a lot of, and think about what is it that matters, because the fear often can get in the way of us living the lives that we want. And so often what we do is introduce people to the idea that you can still live the life you want and have this worry in your mind.
Sorry, excuse me. Before we finish, let's talk about, you know, patients maybe who are hesitant to access your services, who maybe think, oh, you know, I just want to get physically right. You know, why should they contact you? I mean, not everyone. You said earlier on, it's not, you know, not for everyone. You've got to be an individual decision. But why? What might be the sign that someone should look out for that maybe, you know, should trigger them to think, I could do with some psychosocial support?
Yeah, really good question. So I think those signs are often kind of bespoke and unique to the individual. But if it feels like that you feel quite disconnected from who you are, or that worries are kind of taking over, or that your mood is deteriorating and that's getting in the way of you living your life, or stopping you from doing things, often that's a useful time to think about, do I need a bit more support? An old colleague of mine used to use this really nice analogy, which is, if you think about a sports psychologist for, you know, a professional sports team, so then their role is not to address mental health problems in the sports team, but to this is my kind of slightly naive understanding of it, but to ensure that those sports people are performing as well as they can, so that they do the best they can in their sport. And I think we're the same, that we are here not because people have got mental health problems necessarily, not because they're crazy, not because there's something wrong with them, but to ensure that people get through their treatment and live life after treatment in the optimal way.
That's a really good example, because I think sport is, you know, that's probably changed in the last 5 or 10 years, the way that, you know, sports people and sports teams use this kind of support, and it's never for a disaster or a crisis or a crash. You know, it's just maintenance, and it's making sure you're performing every single day by acknowledging that this is really important. That's a really good example, I think. Yeah.
The other thing I often find myself saying to people is, you're not the problem here. Cancer is the problem.
Yeah.
And together we're going to think about how you do cancer as well as you can.
So final question then, how do people do cancer as well as they can? How do they access your services?
So the best way of accessing our services is talking to your, probably to your clinical nurse specialist if you've got one of those, talking to them about how you're feeling, what's going on for you, and they will think with you, like, would it be helpful to come to us, or is there something else that would be more helpful? If you don't have a clinical nurse specialist, talk to somebody in your medical team. We need somebody else to let us know about you.
Right. Well, that's really interesting, Caroline. Thank you so much. I've really enjoyed that, because it is something that I'm really keen to emphasize the importance of the work that you guys do, because I think it's something that you could easily miss. I think in the craziness of a cancer diagnosis, you could easily miss the importance of sometimes just taking a step back and just, working out like that sport example, how can I be in the best shape I can to tackle this, life-changing challenge? And I think you guys are a big part of that. So yeah, thank you for the work you do, and also thank you for talking to me.
Oh, thanks for talking to me as well.